Nurse managers play a crucial role in healthcare facilities, overseeing nursing staff, ensuring high-quality patient care, managing schedules, and coordinating with other departments. Their position demands leadership, clinical expertise, and strong organizational and communication skills. Interviews for nurse manager positions typically focus on leadership experience, patient care knowledge, conflict resolution abilities, and understanding of healthcare policies. In this video, we will explore common nurse manager interview questions. Each answer is introduced with, "Here's how you can answer," to clearly indicate the suggested response. Tips are included to help you demonstrate your leadership, clinical knowledge, and ability to maintain a positive and efficient healthcare environment. Question 1. Why do you want to work as a nurse manager? This question assesses your motivation and understanding of the role. Here's how you can answer. I want to work as a nurse manager because I am passionate about leading a team, improving patient care, and contributing to the efficiency of healthcare services. The role allows me to combine my clinical expertise with leadership skills to ensure that patients receive high-quality care and that the nursing staff is supported and well-coordinated. Question 2. Can you describe your previous management experience? Interviewers want to know about your leadership and administrative experience. Here's how you can answer. In my previous role as a charge nurse, I supervised a team of 20 nurses, managed staff schedules, coordinated patient care, and ensured compliance with hospital policies. I also participated in quality improvement initiatives and provided training to new staff. This experience has prepared me to handle the responsibilities of a nurse manager, including team leadership, operational oversight, and performance management. Question 3. How do you motivate your nursing team? Motivation and leadership are central to the nurse manager role. Here's how you can answer. I motivate my team by setting clear goals, recognizing achievements, and fostering a supportive environment. I encourage open communication, provide constructive feedback, and involve staff in decision-making processes when appropriate. For example, I implemented a recognition program to celebrate exceptional patient care, which boosted team morale and improved overall performance. Question 4. How do you handle underperforming staff? This question evaluates your ability to address challenges effectively. Here's how you can answer. When I identify underperformance, I first assess the root cause, which could be lack of training, unclear expectations, or personal challenges. I meet with the staff member to discuss concerns, provide coaching, and set measurable improvement goals. Follow-up meetings ensure progress is monitored, and support is offered as needed. Addressing issues early helps improve performance while maintaining team cohesion. Question 5. How do you ensure patient care standards are maintained? Maintaining high-quality patient care is a key responsibility. Here's how you can answer. I ensure patient care standards by monitoring staff performance, reviewing care protocols, and conducting regular audits. I encourage staff to adhere to best practices and provide ongoing training to update skills. For example, I implemented a checklist system to ensure medication administration and patient monitoring were consistently accurate, reducing errors and improving patient satisfaction. Question 6. How do you handle conflict among nursing staff? Conflict resolution is a critical skill for nurse managers. Here's how you can answer. I address conflict by listening to all parties, understanding the underlying issues, and facilitating a constructive discussion to reach a resolution. For instance, if two nurses disagree on task responsibilities, I mediate the conversation, clarify expectations, and develop a fair solution. Maintaining professionalism and impartiality helps prevent escalation and promotes a collaborative environment. Question 7. How do you manage staffing and scheduling challenges? Efficient scheduling ensures smooth operations and adequate patient care. Here's how you can answer. I manage staffing by assessing patient needs, staff availability, and skill levels. I use scheduling software to create balanced shifts and maintain flexibility for unexpected absences or high patient loads. For example, during a busy flu season, I coordinated overtime and temporary staff coverage to ensure sufficient nursing coverage, minimizing disruptions to patient care. Question 8. How do you handle patient complaints or concerns? Patient satisfaction is a key measure of nursing quality. Here's how you can answer. I handle patient complaints by listening carefully, empathizing, and taking appropriate action to address the concern. I investigate the situation, communicate with the staff involved, and implement corrective measures if needed. For example, a patient once expressed dissatisfaction with medication delays, so I reviewed the workflow, addressed bottlenecks, and followed up with the patient to ensure their concerns were resolved. Question 9. How do you stay updated with healthcare regulations and best practices? Continuous learning is vital in healthcare management. Here's how you can answer. I stay updated by attending professional development courses, reviewing healthcare journals, and participating in hospital training programs. I also ensure that my team is aware of changes in regulations and procedures. For example, when new infection control guidelines were introduced, I organized a training session to ensure all staff complied with updated protocols, maintaining patient safety and regulatory standards. Question 10. Why should we hire you as a nurse manager? This question allows you to summarize your qualifications and suitability for the role. Here's how you can answer. You should hire me because I bring a combination of clinical expertise, leadership skills, and a commitment to patient care. I have successfully managed nursing teams, implemented process improvements, and maintained high standards of care. My ability to motivate staff, resolve conflicts, and ensure efficient operations allows me to provide both excellent patient care and a positive work environment for the nursing team. Tips for success in nurse manager interviews. Highlight leadership, communication, and conflict resolution skills. Provide specific examples of staff management and process improvements. Demonstrate knowledge of patient care standards, safety protocols, and healthcare regulations. Show your ability to handle high-pressure situations with professionalism. Emphasize continuous learning and staying current with best practices. Final thoughts. Nurse managers are vital to the success of healthcare facilities, ensuring that patient care is efficient, safe, and of high quality. Employers look for candidates who combine clinical expertise with leadership, problem-solving, and organizational skills. Preparing for common interview questions and providing detailed examples from your experience will help you demonstrate your qualifications and readiness for the role. By showcasing your ability to lead a team, maintain patient care standards, resolve conflicts, and manage staffing efficiently, you can leave a strong impression on interviewers. A successful nurse manager balances operational efficiency with compassionate care, fostering a positive environment for both patients and staff. Presenting yourself with confidence, clear examples, and a proactive mindset will position you as the ideal candidate for the position.